Assalamu alaikum. Welcome to a new video. This is probably the last video of Plab Guide Series, and this video is all about clinical attachment. What is a clinical attachment? How to find a clinical attachment? Is doing a clinical attachment in UK worth it or not? Should you spend good amount of pounds on getting an attachment or not? These are all the questions and many more which I'll try to answer in this video. So let's just begin with the first and very important question. What is a clinical attachment? Clinical attachment is a sort of observership or internship that you do in Pakistan, or just like electives that you do in US. During your attachment, you will be allocated to a supervisor or a consultant, and the role that is expected from you is that you can only observe and see what your consultant or supervisor is doing. For example, you are under the supervision of an acute medicine consultant, and today on Sunday he has to be in emergency department. You'll go to the emergency department, you'll just approach your consultant, and you can only observe and look what your consultant is doing, how he takes history from his patient, how he communicates with them, how he plans their investigations, and how he gives their treatment plans. You can only observe how your consultant is working, but you cannot order any investigation or any management, and you can't even touch the patient because you're only doing shadowing. You are only observing your consultant. You're only doing a clinical attachment. So clinical attachment is just an observership or internship where you can only observe what your consultant is doing, what different departments are offering to the patient, how the different setups of NHS are working together, how different departments in an NHS healthcare setup are working together, and most importantly, you can know the overall working of an NHS healthcare setup, which is very important for you as you will be starting your job after clearing your Plab exam. So it's very important for you to have an overview that how different healthcare setups in NHS are working in collaboration with one another, and what are the different departments and what are the different roles at different positions that are expected from you to have. So when you start your first job in NHS, you will know that these are the roles that they are expecting from you, and this is how you gonna fulfill all those roles. So you will be in a very better place in comparison to a person who doesn't know how different things works in an NHS setup. So this is a clinical attachment. Clinical attachment lasts from at least 2 weeks to 12 months. It is basically a contract between you and the trust. So it depends upon your consultant, and it depends upon your HR and your hospital. It depends upon your consultant how long he can supervise you. It depends upon your hospital which departments they are offering you, and it depends upon the HR how long he can accommodate you in that department. So as far as my knowledge is concerned, 60 to 70% of the clinical attachments in UK are paid not sense that they will give you money, paid in a sense that you will have to give money to the trust to get an attachment. There are some 20 to 30% of attachments in UK in far areas or in the peripheries of the UK, or in departments like psychiatry where you can get a free attachment, but it's more suitable to give money to do an attachment in acute medicine in comparison to getting a free attachment in psychiatry. So by the end of the day, it is the experience, it is the clinical experience or the clinical exposure that you get, and that's gonna matter in your CV. So this is all about clinical attachment. What is a clinical attachment? Now let's just come to the second part of the video, that how to get a clinical attachment, and that is also a very difficult thing to do, how to get a clinical attachment. So there are two ways how you can get a clinical attachment. The first way is to contact the HR of all the hospitals and all the departments. In an NHS hospital, there are multiple of departments like general surgery, respiratory medicine, pulmonology, nephrology, neurology, for example, and each department has a different consultants. So these all departments and consultants are controlled by a single HR or multiple HRs of the hospital. So what you're gonna do, you're gonna search on Google what are the biggest trusts of London, and go to the website of the biggest trust of the London. You might find 5 bigger trusts, you might find 10 bigger trusts of the London, or you can Google all the trusts of London, and you can go to their contact panel, contact section, and you can get the email of the consultants or the HR. Most likely you can get the email of the HR, and you're gonna put forward your CV in an email beautifully written together that I am a doctor who is Plab certified or who is going to be Plab certified, and just write one paragraph about you and why you want to do an attachment and the duration and from when to when you want to do the attachment. Attach your CV along with it and send it to the HR department. Okay, one pro tip that I like to give you is that don't ask them for a specific specialty like you want to do an attachment in surgery or like you want to do an attachment in ophthalmology. Just don't say that. You say I want to do an attachment with you. It is one of the biggest trusts of London, and I will be having a very good time at your trust, having to get so much clinical exposure and experience like that. And just attach your CV and send it to them. If they have a vacancy, if they have a post, they will contact you, and if they don't contact you, that means that they are not offering attachment at that time. So this is one way where you contact all the HRs of different hospital or trust and you ask them for a clinical attachment. The second way is to contact all the consultants of the different hospitals, and the same way you write a good standing email, attach your CV and send it to different consultants of different hospitals. But there's a third way, which I call the Pakistani way, and that is the most easy way and the most suitable way to get an attachment. You find someone in Pakistan who has a connection with any consultant in UK, and you ask your referee to ask the consultant to get you an attachment. Okay, basically you use your reference. For example, you have a friend over here in Pakistan who has a relative consultant in UK. You ask your friend to ask his relative consultant to get you an attachment, and when your consultant does the thing for you, it becomes very easy. He'll talk to the HR, he'll make the seat for you, he'll make the post available for you, and he'll transfer you all the essential documents, and he'll sign all the documents from his end as well, and you will get an attachment. So that is how the three ways you can get a clinical attachment. Now to the two most important questions that are more important than what is an attachment and how to find an attachment. Is that a clinical attachment worth it or not? As far as my experience is concerned, I did an attachment for 1 month in acute medicine and respiratory medicine, and I'm not going to go into details, obviously for privacy issues. I'm not going to go in details, but I'm going to tell you, doing a clinical attachment is far way more better than not doing an attachment. So even if it is paid attachment, I'll suggest you to do it if you find it very easily. If you happen to not find an attachment, it is not a matter of life and death. If you happen to find an attachment very easily, whether it's paid or not, do it. If you don't find an attachment comfortably, or you have to struggle very hard for it, or you have to travel like 3 hours or 2 hours every day to go to your hospital doing an attachment, it's not worth it. Just do an attachment if you find it easily. If it's paid or free, if it's free, do it. And if it's easily accessible, then, and if it's in some very good specialty like acute medicine, general surgery, A&E, these fields which are going to be very beneficial for you in your future, because clinical attachment is regarded as experience working in an NHS setup. So when you have experience of working in an NHS setup, your CV goes from here to here. Okay, so there are many posts on NHS jobs where you find vacancies after clearing your Plab. There are many advertisements on NHS jobs where they ask you the first question, do you have an NHS experience? And having a clinical attachment means you have an NHS experience, and you go through that application. But if you don't have any attachment, if you don't have any NHS experience, you can't go forward into that application. So that post only belongs to those people who have done an attachment. So it's very easy to get a job. In simple words, it's very easy to get a job when you have done a clinical attachment in comparison to people who haven't done an attachment. So coming to the last question of the video, should you spend good amount of pounds on doing a clinical attachment? Yes, you should, but if it's only very easily approachable and it's gettable very easily, then you should spend good amount of pounds on doing an attachment, because it's about your future. And when you have spent like 2,000 to 3,000 pounds on going there and clearing your exam, so you can spend 200 to 300 pounds more to get an attachment and to make your CV better, and most importantly for a better future of you as a doctor in the NHS. And even if you don't happen to get a job within 1 month or 2 months after doing an attachment, still the attachment is beneficial for you because you learn different things. You learn how the setup in the UK is different from in Pakistan, how the technology or advancements there are working in comparison to Pakistan, and by the end of the day you become a very, very good clinician because the consultants, they are very experienced over there and they teach you like you are a student in comparison to what our subcontinent countries do. So its clinical attachment from my side is highly recommended to you. I think these are all the points that I should have discussed in regard to clinical attachment. I made this video in English because there might be a lot of people from different countries who don't understand Urdu. So I just wanted to make this video in English. So if anyone wants to get help with how to find a clinical attachment, or either he or she should do an attachment, I'll just try to answer all those questions. If you have any query, if you have any question regarding Plab or the road to UK map, you can email me on the following email, and all the social media links are in the description. If you want to follow my journey, if you want to follow what I do in my daily life, you can follow me on Instagram. I'll see you in another video. Take care of you. Take care of the people around you. Allah Hafiz.